Hi, I'm Ashley Foster here with Erin Kornblith and Delphine Wong. Welcome to PEM Pearls. This time we are going to discuss facial regional nerve blocks for our pediatric patients. You'll want to consider a facial block for any pediatric patient that has a facial injury or pain to the face and ear. For example, a facial nerve block can provide terrific anesthesia for a simple or complex facial laceration. Remember, you can use some great calming techniques prior to any procedure. Please watch our September 2016 video for more details. The procedure itself is quite simple, and the anatomy can be palpated to ensure correct location. The goal is to target anesthesia in the area around the facial nerve selected, which is why this procedure is more of a regional block. The tools you need for this procedure include topical anesthetics such as viscous lidocaine, local anesthetic, we recommend 1 to 2% lidocaine or bupivacaine, a 25 or 27 gauge needle with syringe, and a cleaning substance of choice if you decide to use an approach through the skin. We will cover the most common regional blocks of the face, including the supraorbital nerve, infraorbital nerve, mental nerve, and auricular nerve. In order to identify the approach for the supraorbital block, have the patient look straight ahead. Draw an invisible line from the pupil to the eyebrow, enter into the skin, and inject 2 to 3 mLs of anesthetic. You can draw the needle back almost to skin and redirect medially and inject another few mLs to help anesthetize the supratrochlear nerve. With this approach, you will achieve anesthesia to most of the forehead of that side and some of the nose. This block can be particularly helpful when there is a laceration through or around the eyebrow. For this, you can direct the needle through the laceration and aim towards the spot that you have identified above the pupil. For the infraorbital block, draw an invisible line from the pupils downward and locate the infraorbital foramen, which will feel like a divot. There are two approaches to the block, intraoral or superficial. We recommend the intraoral approach. First, place topical anesthetic roughly where you'll be entering intraorally. Aim for above the maxillary canine. You may need someone to help you hold the lip. The needle should be inserted at the tip of the gum line and angled toward the previously palpated foramen. The goal is to aim for the foramen but inject a few ml of anesthetic right next to it. If you have a particularly active child, you can ask someone to help by holding a tongue depressor just superior to the infraorbital foramen so that your needle can't pass the foramen and get too close to the globe. For the mental blocks similar to the supra and infraorbital blocks, draw an invisible line from the pupil down just below the canines or premolars of the mandible. For some patients, this foramen can be palpated from the outside. We recommend an intraoral approach with similar technique to the infraorbital block. The auricular block will require two approaches, inferior and superior, which will provide anesthesia to the majority of the ear except for the meatus and the concha. For the superior approach, have the needle at a 45-degree angle anteriorly and inject a few mLs of anesthetic. Then, without completely withdrawing the needle, redirect it in the opposite direction and inject a couple mLs. You'll want to do the same thing immediately inferior to the ear to complete this block. Regional nerve blocks of the face are great for local anesthesia and wonderful for a child with a facial injury and or pain to the face and ear. Knowing the anatomy and palpating landmarks makes this procedure simple and effective. Thanks to our wonderful face model, Dr. Tanya Van Gorten. Until next time.